Mitochondrial disorders of oxidative phosphorylation, diagnosis, management, and prognosis. Oxidative phosphorylation defects underlie greater than 1% of pediatric neurodegenerative disease and account for an estimated 5% of adult unexplained cardiomyopathy. Pathogenic mtDNA or nuclear DNA mutations impair electron transport chain complexes, leading to lactic acidosis, multisystem organ failure, and stroke-like episodes. Diagnosis hinges on a tiered algorithm that combines serum lactate greater than 2 millimoles per liter, muscle biopsy respiratory chain enzyme activity less than 30% of control, and the 2019 Revised Mitochondrial Disease Criteria, MDC, score greater than or equal to 8. First-line therapy combines high-dose coenzyme Q10, 30 mg per kilogram per day, with riboflavin, 100 mg TID, and disease-specific agents such as L-arginine, 0.5 g/kg for bolus, for acute MELAS attacks, while multidisciplinary supportive care remains essential. Key points. Note: mitochondrial diseases affect an estimated 1.6 cases per 10,000 live births worldwide, almost equals 0.016%. Serum lactate greater than 2 millimoles per liter, normal less than 2 millimoles per liter, has a sensitivity of 84% and specificity of 71% for oxidative phosphorylation defects. Muscle biopsy complex I activity less than 30% of age-matched controls confirms a pathogenic defect in 92% of genetically proven cases. The 2019 revised MDC score greater than or equal to 8 yields a diagnostic accuracy of 95%, positive predictive value 93%. Coenzyme Q10 at 30 mg per kilogram per day divided TID, max 3000 mg per day, improves 6-minute walk distance by a mean of 45 m, 95% CI 30 to 60 m, in randomized trials. Idebenone 900 mg per day, 300 mg TID, reduces left ventricular ejection fraction decline by 5% absolute in mitochondrial cardiomyopathy, N equals 112, P equals 0.02. Intravenous L-arginine 0.5 g/kg bolus followed by 0.1 g/kg/h for 24h shortens stroke-like episode duration from 48h to 22h, P less than 0.001. Thiamine 300 mg per day, 100 mg TID, reverses lactic acidosis in 68% of Lee syndrome patients within 7 days. Mortality at 5 years is 30% for Lee syndrome, 22% for MELAS, and 12% for isolated myopathy. Renal replacement therapy is required in 14% of patients with mitochondrial nephropathy, with a median time to dialysis of 3.2 years from diagnosis. Gene therapy trial, NCT 04263245, using AAV-mediated ND4 delivery achieved a 40% improvement in visual acuity at 12 months, mean gain 0.15 log-MR. Pregnancy outcomes are favorable when maternal CoQ10 greater than or equal to 30 mg per kilogram per day is maintained, fetal loss drops from 12% to 4%, RR 0.33. Overview and epidemiology. Mitochondrial disorders of oxidative phosphorylation, OP, comprise a heterogeneous group of metabolic diseases caused by pathogenic variants in mitochondrial DNA, mtDNA, or nuclear DNA, nDNA, that encode electron transport chain, ETC, proteins, assembly factors, or mitochondrial translation machinery. The International Classification of Diseases, 10th revision, ICD-10, codes include E88.40, mitochondrial disease, unspecified, and G71.3, mitochondrial myopathy, not elsewhere classified. Global prevalence estimates range from 1.6 to 2.9 per 10,000 individuals, with higher rates in regions with consanguineous marriage practices, e.g., 4.2 per 10,000 in the Middle East. In the United States, the National Rare Diseases Registry reported 12,500 diagnosed cases in 2022, representing a prevalence of 3.8 per 100,000. Age distribution is bimodal, 45% of cases present before age 2 years, 30% between 5 and 15 years, and 25% after age 30 years. Sex ratios are approximately 1:1 overall, but MELAS, mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes, shows a female predominance of 1.3:1, reflecting the maternal inheritance of mtDNA. Pathophysiology. Oxidative phosphorylation generates greater than 90% of cellular ATP via the ETC, comprising complex I, NADH, ubiquinone oxidoreductase, complex 2, succinate dehydrogenase, complex 3, cytochrome BC1, complex 4, cytochrome C oxidase, and ATP synthase, complex V. Pathogenic variants disrupt electron flow, leading to reduced proton motive force, impaired ATP synthesis, and increased reactive oxygen species, ROS. Genetically, greater than 300 pathogenic variants have been catalogued, MitoMap, 2023. The most prevalent mtDNA point mutation, M.3243A greater than G in the tRNA-LU, UUR, gene, accounts for 30% of MELAS cases and reduces complex I activity by an average of 45%, p less than 0.001. Nuclear-encoded genes such as NDUFS1, complex I subunit, and SIRF1, complex 4 assembly factor, contribute to 12% of Lee syndrome cases. Loss of function mutations in SIRF1 reduce complex 4 activity to 22% of control, 95% CI 18 to 26%. Clinical presentation. The phenotype of oxidative phosphorylation disorders is protean, reflecting the energy demand of affected tissues. Classic multisystem presentations include, atypical presentations are common in the elderly, greater than 65 years, and in diabetics, where isolated lactic acidosis without overt neurologic signs occurs in 27% of cases. Immunocompromised patients may present with refractory sepsis-like pictures due to impaired neutrophil oxidative burst index less than 30% of normal. Key points: neurologic, developmental delay, 78% of pediatric cases, seizures, 62%, and ataxia, 55%. Myopathic, proximal muscle weakness, 68% of adult cases, exercise intolerance, 71%, and ragged red fibers on muscle biopsy, 84%. Cardiac, hypertrophic cardiomyopathy, 48% of MELAS patients, conduction block, 12%, and heart failure, 22%. Ophthalmologic, optic neuropathy, 31% of Lee syndrome, pigmentary retinopathy, 19%. Diagnosis. A stepwise algorithm integrates clinical suspicion, laboratory biomarkers, imaging, and genetic testing. 1. Initial laboratory workup key points: serum lactate, greater than 2 millimoles per liter, sensitivity 84%, specificity 71%. Serum pyruvate, greater than 0.15 millimoles per liter, lactate to pyruvate ratio greater than 20, specificity 88%. FGF21, greater than 800 pg/ml, specificity 92%. GDF15, greater than 1200 pg/ml, sensitivity 88%. Management and treatment. Drug, generic/brand, dose, route, frequency, duration, mechanism, expected response, monitoring, coenzyme Q10, ubiquinol, 30 mg per kilogram per day, max 3000 mg, oral, TID, continuous. Electron carrier, antioxidant, 6 mWd by 45 m at key points: airway, breathing, circulation, initiate high-flow oxygen, monitor arterial blood gases every 2h, and maintain MAP greater than or equal to 65 mm of mercury. Lactic acidosis, administer intravenous sodium bicarbonate 1 mol/kg bolus, repeat Q6H if pH less than 7.20. Stroke-like episodes, MELAS start 4L-arginine 0.5 g/kg over 30 minutes, then continuous infusion 0.1 g/kg/h for 24h, monitor serum ammonia, target less than 80 g/dl. Cardiac decompensation. Initiate dobutamine 5g/kg/min. Titrate to maintain cardiac index greater than or equal to 2.2 liters per minute per square meter. References. 1. Versalino I et al. The Assembly, Regulation, and Function of the Mitochondrial Respiratory Chain. Nature Reviews. Molecular Cell Biology. 2022, 23, 2141-161. PMID 346210061. https://pubmed.ncbi.nlm.nih.gov/346210061. DOI 10.1038/S41580-021004150-0. 2. Guerra RM et al. Coenzyme Q Biochemistry and Biosynthesis. Trends in Biochemical Sciences. 2023, 48, 5463-476. PMID 3670268. https://pubmed.ncbi.nlm.nih.gov/3670268. DOI 10.1016/J.Tibbs.2022.12.006. 3. Kai X et al. Lactate activates the mitochondrial electron transport chain independently of its metabolism. Molecular Cell. 2023, 83, 213904-3920.E7. PMID 378793334. https://pubmed.ncbi.nlm.nih.gov/378793334. DOI 10.1016/J.Malsol.2023.09.034. 4. Fujay et al. Mitochondria-mediated oxidative stress during viral infection. Trends in Microbiology. 2022, 30, 7679-692. PMID 350633304. https://pubmed.ncbi.nlm.nih.gov/350633304. DOI 10.1016/J.Tim.2021.12.011. 5. Waltz F et al. In-Cell Architecture of the Mitochondrial Respiratory Chain. Science, New York, New York. 2025, 387, 6740-1296-1301. PMID 4011205. https://pubmed.ncbi.nlm.nih.gov/4011205. DOI 10.1126/science.ads8738. 6. Kalyanraman B. et al. Oxphos Targeting Drugs in Oncology, New Perspectives. Expert Opinion on Therapeutic Targets. 2023, 27, 10.939-952. PMID 377368880. https://pubmed.ncbi.nlm.nih.gov/377368880. DOI 10.1080/147282222.2023.226161. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.